How can you prevent chemical pregnancy? There's very little that you can do to prevent chemical pregnancy. First, you should know that chemical pregnancy is not your fault. It's not the fault of your partner either. But there are certain things that you can do to just help fetal development, to help your baby to develop well. And that includes So today I'm going to be talking about why you have a positive pregnancy test result and soon after you lose it. This is actually called chemical pregnancy and it is more common than you think. I'm also going to be talking about how to know that you might have actually been pregnant but you've lost it, because sometimes, so many times, women get pregnant but they don't even know that they got pregnant, because they see their period almost at the same time they're supposed to be menstruating. This is called chemical pregnancy and I'm going to be talking all about chemical pregnancies today. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I'm a fertility physician and my channel focuses on everything women's health and infertility. So if this is something you think that you'll be interested in, click the subscribe button below, like this video, share with your friends, and drop a comment below if you have questions. Chemical pregnancy is a very early miscarriage. It happens before the pregnancy even reaches 5 weeks. And by 5 weeks, I mean 3 weeks post-fertilization. Okay, let me break this down a little bit. So, by the time you have a missed period, that is actually 2 weeks post-fertilization. But in medicine, we call it 4 weeks gestation because we are counting from your last menstrual period. I don't know if this makes sense, but just do a mental calculation to understand what I've just said. It happens days after a missed period, so some women might not even notice if they were ever pregnant. So you can, when you miss your period today and you wait 1, 2, 3 days, you might see your period and you will never actually know that you were pregnant, except you do like a pregnancy test. In chemical pregnancy, the fertilized egg is lost shortly after implantation occurs. In the hospital or the clinic, how chemical pregnancy is diagnosed is when you see your period after a positive pregnancy test result, or after a positive pregnancy test result, when we give you an appointment for scan to confirm the pregnancy, we don't see any sac, any sign that there's a pregnancy. So apart from a positive pregnancy test result, there are other signs to look out for to know that, oh, you might have been pregnant, but you didn't know about it. And those signs include heavier than normal period. Even a normal day, you use 2 pads in a day, and then you're having to use 5 pads, 6 pads in a day, or even sometimes as little as just 1 extra pad, 3 pads in a day. And then you have clots. You look out for blood clots, like clumps of blood on the pad. Then yes, you might have been pregnant. Or you're someone that does not have menstrual cramps on a normal day, and in that particular period you are having menstrual cramps, whether it's mild, moderate, severe, that could give you an idea that you might have been pregnant. Also, when you don't have pregnancy symptoms, no sore breasts, no nausea, no vomiting, no morning sickness, but you had a positive pregnancy test, that could indicate that you are having a chemical pregnancy. It could indicate. What causes chemical pregnancy? The exact cause is not known, but some of the causes implicated includes genetic abnormalities in the embryo. So when you have an embryo that doesn't have complete chromosomes, or has abnormal structure of chromosomes, or abnormal DNA in the chromosomes, we say that this could possibly cause a chemical pregnancy. Also, lack of proper attachment, lack of proper implantation on the uterine wall in the womb. Because normally after fertilization, the zygote travels through the tube and gets into the womb, into the uterus, and it's supposed to implant inside the wall of the uterus so that it can start growing to become a baby. But sometimes, and this uterus is, the lining is supposed to be really thick enough so that the embryo can attach well. But sometimes the lining might not be thick enough, might be thin, and this could cause improper implantation, and it could actually cause chemical pregnancy. Also, low body weight. So if you are underweight, you are less than the normal weight for your height, it could also cause chemical pregnancy. How can you prevent chemical pregnancy? There's very little that you can do to prevent chemical pregnancy. First, you should know that chemical pregnancy is not your fault. It's not the fault of your partner either. But there are certain things that you can do to like just help fetal development, to help your baby to develop well. And that includes taking prenatal vitamins. So when you're trying to get pregnant, try and get prenatal vitamins. They are supplements. You just walk into the pharmacy, even stores, you can just get prenatal vitamins. Ensure that it's not expired, and also ensure that it contains folic acid, which is very essential in preventing neural tube defects, which is a congenital defect that you don't want in your baby. And also look out for DHA, that helps with the brain, the cognitive development of the baby. Also, it's important to note that chemical pregnancy does not reflect. It is not a reflection of you or your partner's ability to actually conceive, because it is in no way your fault that it happened. Some risk factors, however, includes if the mother has a history of diabetes, if she has a history of PCOS, polycystic ovarian syndrome. Polycystic ovarian syndrome is actually the most common hormonal imbalance, and it usually causes like irregular menstruation, few or no menstruation at all. So this is actually implicated in chemical pregnancy. Also, diabetes is a disease of regulation of sugar in your body. Another risk factor is pregnancy in women greater than 35 years old. So they usually have like a higher risk of chromosomal abnormalities, that's genetic abnormalities in their fetus. And then when you have thyroid problem, your thyroid is here. When you have thyroid problems, it could also be implicated in chemical pregnancy. And the last one I'm going to talk about today is pregnancies that are achieved with IVF. So chemical pregnancies is one of the common causes of, is one of the common complications of IVF. So the woman gets pregnant, you're seeing a positive pregnancy test, but 2 weeks after, when you invite her for a scan, her first obstetric scan, you might not see anything on the scan. So that's a common complication as well. It's a common complication of IVF. Will chemical pregnancy affect your fertility? It shouldn't. It shouldn't really, because you can, if you have a chemical pregnancy this month, you can go ahead to get pregnant next month. Normal pregnancy, healthy pregnancy, multiple pregnancy, right away if you wish. It doesn't have to affect your fertility. A lot of people that have had chemical pregnancies have gone on to have healthy pregnancies, healthy babies. So what you should do when you have multiple miscarriages, multiple chemical pregnancy, please see your doctor, see a specialist for proper evaluation, for proper examination. The treatment for chemical pregnancy is no treatment, because most times it just happens. Like, you might not even know it happened, and it might just come out as your normal menstrual period or a slightly heavier menstrual period. So there's really nothing to treat. So I'm going to be talking about how to cope with miscarriages, whether it's early miscarriage, late miscarriage, miscarriages in total. Because whether you saw a positive pregnancy test today and the next day you're menstruating, and it was that short, it can be really emotional for some people. So this is a very emotional thing, and I'm going to be talking about how to cope with it. People have different ways of dealing with grief. So number one, realize and accept that your feelings are normal, that your feelings are okay. It's okay to feel the way that you feel. Also, everyone grieves at different paces. So know your pace, maintain your pace, grieve in your own way. Emotional support is very important at this time, so you can consider joining a support group. If you feel overwhelmed by grief, consider talking to a therapist. Friends, family, your spiritual advisors can actually help you through this period. They can support you. Open up to your partner. Communicate with your partner about your true feelings. Also, it's normal to feel scared of getting pregnant again. And remember, sometimes emotional healing takes longer than physical healing. If you found this video informative and you want more content like this, please subscribe to my channel, like this video, and see you in my next video.